Good morning, everybody. This is Dr. Michael Richmond, a double board certified cardiothoracic surgeon. Just wanted to touch base this morning on a very important topic. And the topic is, does a needle biopsy of a solid tumor or mass in your body that could be cancer possibly spread cancer? And the brief answer is no. So a friend of mine who's a physician actually texted me this morning that he saw something on Instagram, which already made me pause, that you should never have a needle biopsy of a solid mass in your body because you're going to spread cancer. So first of all, a little bit about social media, quote, medical advice, end quote, from a non-medical doctor. I think everybody knows that anybody can say anything. And if you have an audience who's willing to listen, it's great, but you're not an expert. You need to do your own research and see what the real literature says. Second, so whenever you have a solid tumor, we need tissue because we need to say whether it's benign or whether it's malignant, which means cancer. Okay? So without knowing, we can't provide treatment. The next question is, what type of biopsy should you have? So the first thing, you can have a needle biopsy, which is usually CT guided or ultrasound guided, and that's where an interventional radiologist puts a needle and gets cells and some tissue. The second would be a core biopsy, which is a thicker needle and you're actually getting a core of tissue. So more tissue the better. The third is an excisional biopsy where you're actually excising the whole mass. And that would be, let's say, of a breast mass that you can maybe get completely. Then fourth, there's something called an incisional biopsy where you're actually taking a piece of the tumor. In other words, the tumor's so big and you can't get it and completely remove it with an excisional biopsy, or you can't reach it with a needle. And you know that's not going to yield enough tissue, so you need to do an incisional biopsy. But let's quickly get back to a needle biopsy. So the literature is pretty definitive, and it's been studied very extensively. So for breast masses, for example, in the large trials, a needle biopsy has been shown to cause cancer cells along the needle tract in approximately 0.7% of patients. Not very many. A core needle biopsy in a breast mass, which is the thicker needle, has not been shown to decrease progression-free or overall survival in a very large study of 9,900 women. Now, in terms of solid tumors in other parts of the body, for example, like a sarcoma, which can be an extremity or basically any other place in the body. They're just big solid tumors. The incidence of spreading tumor is also about 0.38% in two major studies. Now, when it comes to doing an incisional biopsy, it depends on the tumor type, the location, and the technique. And it has been reported to be about 12 to 22% for sarcomas and other malignancies, which is a lot. The most important thing to do if there is a mass, however, is prompt diagnosis and a complete workup, hopefully within 30 days, because that will affect your overall survival. And we like to do the least invasive way to do it, like a needle biopsy or a core biopsy. And if surgery is ultimately done, we resect the needle tract. Okay? So all in all, you need tissue. You want the most least invasive way to do it, and you get enough tissue, you make a diagnosis, and you proceed from there. So I hope you have a great day. Thank you for listening. If you need more information, you can go to my website at www.paladinmds.com, and thank you so much for listening.